problem solved.
When you gonna plant your garden?
Jackie Adkins' parents live on their own, but she handles their bills.
Huh, Daddy? This prescription is too high.
Her dad takes the generic drug for Zyprexa for his mental health. In January, she went to Walgreens to fill his prescription. The bill?
$685.09. He had to pay $372, I believe, his part for 30 pills. And I was like, he can't afford this.
So she got out her phone book and started calling around for a better price.
Wood's Pharmacy was $25 for the same medicines.
That's right, $25 for the same medicine that cost more than $600 at another pharmacy. After discovering this huge price difference, she wanted answers.
I said, I'm calling Channel 2 News. I said, maybe they can tell me why there's a difference in this price.
We asked experts in the pharmaceutical field about the price difference. They were shocked by the extreme cost comparison.
Kind of blew my mind. It was that far out of line.
There might be a $20 price difference or even a $40 price difference, but I've never heard of a price difference that was, $550 plus.
They admitted one of the main reasons for different prescription prices has to do with a lack of oversight.
There is no regulatory agency that monitors pricing of generics.
No.
So we went to work comparing drug prices ourselves. We found much more than a $40 difference in some common generic drugs. The top 5 drugs we found: the generic for Zocor, which treats cholesterol. The cheapest price we found, $19, and the highest, $121. For the generic for Arimidex, a hormone treatment, lowest cost $16, highest price $156. The generic for Plavix for heart problems, least expensive price for $181, and most expensive $332. For the generic for Seroquel to treat mental health, we found it for $180 at one pharmacy and $348 at another. And of our non-scientific survey, generic drug with the biggest price difference was for prescription strength Prilosec for heartburn, with a low of $33 and a high of $235. So how can you save money? First, shop around. Remember that prices vary, especially with generic medications. We often found that the smaller pharmacies were cheaper than the big chain stores. And secondly, be aware that sometimes your cash price is cheaper than your insurance copay. So ask for both prices.
But the whole idea is to save the patient some money by saying, don't pay the $20 copay. I could sell it to you for $12.
It's saving Jackie's family money.
Daddy spent more money in January for his medicine than he'll spend now for a whole year.
And that takes the sticker shock out of filling prescriptions for generic drugs. Jamil Donif, 2 News works for you.